These issues are often discussed from a public policy standpoint. The video mentioned healthcare access. That's indeed some key aspect of it. Now, it seems the jury is still out as to how it impacts businesses themselves and investments. In this industry, and in Asia in particular, we're seeing conflicting trends which make it difficult to figure out whether it's good or bad for investors what is actually happening in healthcare right now. If you think about it, on what side of the coin, you've got an increasing demand for healthcare. Talk about demographics. People over 65 years of age are going to represent, within a very short period of time, 25% of the population in Singapore alone. And you can think about other geographies like Japan, where it's even worse. You've got an increase in chronic diseases which require healthcare. In Vietnam, for instance, 7 in 10 deaths right now are due to heart attacks, diabetes, cancer, and chronic lung disease. I mean, all of that is chronic diseases that need healthcare. And this demand can be addressed thanks to new medicines, thanks to personalized medicine. So that's the good news for the businesses and for the investors. But now who is going to pay for that? That's one part of the issue. Government budgets have constraints, and you also have other operational constraints which we're going to talk about, like human resources. Do you have qualified personnel to take care of the patients? So we see that traditional solutions may not be enough to cope with the new situation, and we have to think about new possible solutions, including new technologies, digital technologies, think about AI, medical technologies like robotics, we're going to talk about it as well, and maybe even to invent new business models. So what does all that mean for investors? I think that's the questions that we're going to try to address. I've got 3 distinguished specialists to discuss that with me this morning. So I have Sean Ngue, who is the CEO of Ardmore Medical Group. Ardmore Medical Group is based in Singapore and provides multidisciplinary specialist healthcare to help people age well. Sarper Tanil next is Group CEO of Manzil Healthcare Services. And Manzil is providing high-quality technology-enabled, that's the key word, multidisciplinary healthcare to patients at their home. And Amit Varma. Amit is the co-founder and managing partner of Quadria Capital. And as many of you know, Quadria Capital is the leading private equity investor in Asia in healthcare. The first question, thank you gentlemen for being with us this morning, and the first question I would like to ask you actually, to ask the 3 of you, because you're practicing in different geographies all the way from Turkey to the Philippines. Could you draw for us a very quick overview of the landscape regionally? We heard yesterday at one of the panel that private equity investment was, China was #1 by far, and then it was India, and then ASEAN. Is it the same for healthcare, and how do you see that? And then we'll go into the specific issues that I mentioned earlier.
Good afternoon, and we realize that we are between you and lunch, so we guess we need to make this a bit more entertaining. Couple of startup points. Clearly, there is no debate to my mind that there are 3 blocks when we look at Asia. It's the ASEAN, it's India, which actually is South Asia, and then you have China, which is a completely different animal of its own. So the investing, the logic, and how you make money over there is a bit different than others. I just wanted to start off by painting the landscape, as you said. We are going to be 2/3 of the world's population sitting this part of the world, that is Asia. By 2024, we will be spending $4.3 trillion in healthcare. This, by the way, is the combined spend of US and Europe today. We will have the world's largest population of diabetics, hypertensives, cancer patients. We will have more than 75% of the world's population of people who are more than 65 years of age. And the last, which is the most worrisome point, is that even today, 70% of Asia's population pays for healthcare out of pocket, which means there is very limited public or private healthcare insurance. So what does that mean? As you mentioned earlier, private capital will continue to play a very important role, at least for the next decade. We will have to provide high quality outcomes, best quality results at the least possible price, because our patients demand it. And finally, I personally believe that we are sitting on a massive epidemic and we don't know where the cliff is coming and how we're going to fall across.
But I would like to add to this, and we're now based more in Middle East, but coming to Southeast Asia. So from the Middle East point of view, the problems are, all the issues are same. But what's happening, we see for the private sector, in Middle East, they're more public-oriented, all the way from Turkey to and all GCC. And historically, the service has been provided by the public sector more and more. But it's been a big shift in the last 5 to 10 years. And more, and governments are looking into public-private partnerships, open up the services for private sector to invest. The reason is that private sector is no doubt not only understands the problems, but acts faster. And then only to be able to be successful and then make the returns, you have to provide a good quality service, and because you're in the healthcare business. So even in a much smaller scale in terms of a size, issues that everyone deals with now is the same, the chronic disease, aging populations, but a lot of opportunities to move into and bring the private investment to the market.
Sean?
Hi, yeah, we are a Singapore group based in over here, and we provide specialist healthcare services. And what we have noticed, it's a shift actually in terms of management principles. In the past, it was really trying to treat problems, treat diseases, and treat things that come onto you. But now, because of the aging population, because of the lower fertility rate and the aging population, you really want to try and catch all these problems, these chronic problems like diabetes, hypertension, heart disease, cancers in the early stage. Try and educate the population and teach people what to do, what not to do, how to improve your lifestyle, and really try and capture and catch all these problems early on so that you can have better treatments for the patients. They have better results because they are discovered, the problems are discovered earlier. They know how to manage the problem. So I think that is one way. It's a bit different here, and it's coming on in all these this region.
I was mentioning earlier demographics and aging population. Sean, it is anticipated in Singapore that the population over 65 doubles between 2050 and 2030. What does it mean in terms of investments and in terms of providing healthcare? Is it just about building more nursing homes, or is there more implications than just that?
I think this, like you said, this doubling of the aging population above 65, it's going to be prevalent in all the countries in this region in time to come, even in India, even in China. By 2030, I think almost 30% of the world's population, are above 60, 65 years old, much more than the number of the population below 5 years of age. So we have to try and find ways to try and manage this increased aging population. Right now, aging, when you say 65, it's not really a numbers game, because a person who is 65 years old today, it's completely different from a patient or person who is 65 years old 20 years ago. Everyone is more active, they travel more, they do more, they are much more in tune with the lifestyles and where they want to go, where they want to do. So in terms of nursing homes, yes, you have to plan for the future. You may have more nursing homes, you may have bigger nursing homes, but I think what is more important is the quality of the nursing homes. Right now in China and in Japan, where the proportion of the aging population is very high, nursing homes have become so high-end. They provide excellent facilities and programs and lifestyles for these, I wouldn't use patients, but clients, in fact. So you have to target that population. So nursing home play is one possibility, but I also think in terms of other potential plays would be things with regards to the paramedical or companies that can support this aging population. We're talking about pharmaceutical companies, for example, that are catered towards the chronic diseases, you know, in terms of cardiovascular, in terms of oncology. You're talking about implant companies, you know, that do a lot of implants for the aging population. You know, for example, I'm an orthopedic surgeon, so implant companies are very close to my heart because I put in a lot of implants in patients. And you know, you have better implants for the patients. You have more advanced implants that can last much longer and are more robust. Previously, you have implants that are just stainless steel, and now they've progressed to cobalt chromium, which is an alloy which can last long. And now they've even progressed to ceramic implants which can last even longer. So this actually caters to the aging population. And sometimes also in certain subspecialties, we actually have implants that are dissolvable. You know, so instead of the classical metal that remains in your body permanently, we actually put in metallic implants that dissolve with time. So all these are important to some patients, and I think it's a potential place as well. And of course, services that can help, for example, AI, you know, when you can help to detect diseases earlier on, and they can help to catch the disease early on, and so we can help manage the patients and treat the problems early on. These are important places as well.
Well, all of you operate hospitals directly or indirectly, either as investors or as operators. There has been a shift in business, or there is being a shift in business models from volume-based to outcome-based. I mean, this is something that has been in discussion in the US mostly because of inefficiencies for a number of years, and they start to implement it now. Is it something that we see coming to Asia? I mean, this is a tectonic shift. This is a major move. Do you see it happen in Asia, or do you see this as sometime in the future, but not too soon, Amit?
I think to my mind, quality is no longer a desired outcome, but an imperative. There is no way that any patient, any part of the world will accept an inferior outcome just because they are paying lesser or somebody else is paying for it. So to my mind, outcomes are a fundamental which will not just define what the patient standard would look like, but more importantly, help us improve efficiencies. Let's face it, in Asia, we will never ever be able to cater to the volumes of patients, never ever. But what we can do is make our back-end systems and our efficiencies a lot higher, which will then improve throughput, which then will improve cost efficiencies, and then more importantly, lead down to the bottom line. So to me, focusing on quality is another way of looking at how to improve my EBITDA margins.
Okay, and so if you've got to provide this quality at a cost which is lower than the current costs, what do you see, how can you do more with less, and what type of investment can you?
Volumes of scale. Everything that you do has to be thought of how you scale up. So we have an investment, let's say, in a hospital in southern India in Hyderabad. It's called the Asian Institute of Gastrosciences. It is a 1,000-bed hospital which does about 300 endoscopies a day at a cost of $13 to the patient. This hospital, at the end of all of the, by the way, we do endoscopies all the way up to pancreatic transplants. This hospital delivers us a margin of north of 35%. So there are live examples across the region where you start to cater of huge volumes, supply chains, possibilities, back-end synergies, and more important, go out and get the manpower who's skilled to these procedures and still make money.
And in addition to manpower, Sean, do you see other investments that would be necessary to cater for that volume and be able to hit these bottom lines?
I think like you mentioned, more for less. You're really looking at efficiency and function. You want to invest and be involved in technologies that help to increase efficiency as well as function.
And the question is, why these companies coming up? Because when we look at the healthcare systems, we were more focusing on sick care. Like we want to make sure that we catch the patient, we do the right diagnosis, and we do the treatment, we do the surgery. But the question is, what happens after? And also, the question was also, what happens before? So then we moved to more of a sick care to healthcare because of all of the problems we just mentioned earlier. And the digital health companies started coming up. But there's one of the things that started populating in the market, digital health being more of a perception more towards the primary care. Primary care more on the telehealth side, which is very, very good, perfectly fine in terms of physicians to be able to talk to the patient before even go to the hospital or clinic. That's incredibly powerful when you look at the countries like Indonesia, and there's not many access to the care, or absolutely is an amazing tool for cost optimization as instead of going to the every time a specialist, which is a very much of a story in Middle East, that you can really see and talk to the primary care physician, even with the guidance of what they need to do next. So, but digital health is becoming more on the forefront, but rather and more we need to start looking into what exactly the business model that digital health is bringing on to the market. Because a digital health company is coming up and is more than they start building the business model, it doesn't work. You need to have a business model that can make the consumer more access to the care and collect the information from the consumers more and more. But without that business model, which needs to be really adapted for every market, and based on the regulations, based on the size, based on the accessibilities and all, then to build the digital platforms on top of it is very critical. And that now that we see, you know, Google, Alibaba, they're all building digital platforms to be able to access to more data, which is actually, for me, is a great news, because in healthcare for the last 30 years, healthcare institutions, governments spent lots of money to be able to integrate and interface and in the sick care data, right? For us to be able to create that big data that we can really use the augmented intelligence, you know, help the physicians to do predictions and make a decision on the treatment and everything else. But again, there was very much of it's only one episodic part. And it took like many years, and I cannot really count many good examples of this such a integrated models and to be able to collect the patient data. So what later came on, the wearables, of course, then the data being collected outside of hospital, but very fragmented as well. And now that we're moving into more consumer stage in healthcare, and consumers know much more than physicians, they want to understand better what's going on, and then we need to really reach out to the data that is available in their daily lifestyle. So how we can use that through the digital health companies or the platforms like this is very critical for healthcare operators and service providers. Use that not only for prediction purposes, so you can really think of what else to provide in the services for quality outcomes, value-based outcomes, but also really start moving into managing those people's life is very critical. And then we are more started talking about population health is becoming not only the job of the government, also the systems and hospitals and providers as well.
But then the control of data becomes key, and you want to have a free access to this data, or how do you see the model operating? Because these huge companies that are gathering the data indeed.
Absolutely. So no doubt the who owns the data question has been around for so many years. We can dispute for days and hours. It's definite that data is owned by the person. There's no other way around this. And in the hospital side, we were always like being hold of the data and not to really release to others, even sometimes the patient consent, because we want to hold the patient. So that's the fact too. And so we have to create regulations not only to define who has access to data, but all more important, how the data is going to be used. Because, you know, we all are being honestly giving a lot of data to Google and Amazon already, right? And so the question is, we will be definitely giving those data with our consent, but how the data is going to be used, it has to be used for the good cause. So then you need to, and I think the regulators need to create that framework to make sure that that data is being used and for the predictions, augmented intelligence, really understand the lifestyle of the people so we can really improve the life, not only when they come for the sickness. That's what I believe. So I think it's open, and someone can say, well, I don't want to give my data to anyone. That's, of course, for their own decision to make. But once you sign up that consent, once you download that app, you're basically consenting that that data should be used for the good reasons, for a good cause.
Amit, another type of investments or another silo of investments is medical technology, and that includes robotics and surgery robotics in particular, and I know that you do invest in these areas as well. I've seen reports recently, particularly in the US, questioning whether the investments to develop these robots actually was justified by the efficiencies or the additional efficiencies granted by these robots to the healthcare professionals. What's your take on that?
I mean, as a doctor, I can tell you there is no debate to my mind that technology enhances efficiency, reduces errors, and makes you more efficient as a system. So there's no debate to my mind. Having said that, there are two issues that I've seen in robotics, and Sean probably later could also comment on it since he's a orthopedics guy. My view is the following, that these technologies take a longer time for people to adapt because it requires a certain skill set. And imparting skills to our manpower who in this part of the world are grappling with basic issues, and then having them get into super specialized robotic surgeries, to my mind, is a bit of a mismatch, number one. Number two, the payment system again in our part of the world, and I'm sorry I keep coming back to that because here again, the patients are paying for any extra costs because again they are paying out of pocket. Right now the models that work in this part of the world is that if they are using, an orthopedic surgeon is going to use robotic or navigation, the consumable cost and the extra cost is borne by the patient. To my mind, technology will continue to advance even in Asia, and at some point of time there's going to be this synergy that the extra cost may be worth it because of the cost efficiencies that are derived from the technology. And clearly you cannot stop technology. So the stuff that you keep hearing in the US about whether robotics is more efficient or not, I think is a matter of conjecture. It finally, unfortunately, and a lot of surgeons will not tell you that, surgery is not science only. It is a lot of art, and you keep getting better. The more you do, the better you get.
Yes, Amit. Yeah, so I've got to agree with what he said. So robotic surgery, it's very new, it's very upcoming. There are new machines, new robots every other year. Right? They are extremely expensive, and patients pay a large chunk of it. For example, you do a knee replacement, we have a new robot called a RoboDoc, or even Mecoplasty, but that's an additional $10,000 to the patient for the consumables and to the hospital as well. Some insurances allow that, some don't. Many, which means if you really want to opt for that, you have to come up with 10K from your own pocket. But the difference is that robotic surgery, that additional bit of technology, worth the cost and worth the surgery. Because the fact is, knee replacements have been done for the past 30, 40 years, and most patients turn out okay. Because actually the advantage of a robot is greater accuracy, all right, greater placement of the implants. We are talking about a matter of degrees or even 0.5 degrees. Whether I put the implant 0.5 degrees to the left or 0.5 degrees to the right. But this is just really what you see in X-ray. But what is more important, I feel, is actually the clinical outcome and patient satisfaction. So patient, for example, if you try to advertise robotic surgery, you may want to say that, oh, the patient, there's improved accuracy and placement of implants, but does that actually translate to better patient outcomes? So whether the patient feels less pain, whether the patient can walk better, whether they can have improved function. So all these still require a lot of studies, require a lot of cohort studies, and it's only actually relevant and applicable to really the more developed countries, I feel, or to countries that can afford that kind of expensive, fancy stuff. For the majority of the region, like what Amit has rightfully said, cost is still very important. And I think for a patient, for example, who requires a knee replacement, and he can have access to just a standard one without having to go for this fancy robotic surgery, and it does improve his way of life. He can walk better, he can go and function in his job better. I think that's most important. So
I want to
there's
add
a balance.
a couple of different maybe angles on this. So when you look at the technology, there's no doubt that medical technology and digital technology goes far ahead of the systems. And there are two reasons for this, I believe. One is the payment mechanisms, absolutely right. The other one is the adaptation to the technology of the staff. So I tell you from my experience, we were a pure service company only 2 years ago. Now we have a pure digital health company with services under it. But during that transformation, digital transformation happening everywhere, in hospitals and everywhere else, the adaptation of the staff to the digital tools is not that easy. So you have to create the, I call it digital fluency. That fluency has to be at the skills of the nurse, and not only the physicians and everybody else in the entire system, from the nutritionists to everywhere else. So you need to build that capacity and competency as the digital fluency. Then when it comes to the systems, we talked about this remote patient monitoring. It was available 20 years ago. And now it's still being questioned by the systems and payers. Do we really need to use it? Is it a proof of concept? Absolutely it's a proof of concept. So what you do for us to be able to disruptive, because consumers adapt much faster. So if you go to the consumers, explain what technology is available, what technology they use, and in the palm of their hands, and I think that will really bring the system in a different angle and make it much faster returns.
But talking about the consumers or the patient, and you were talking about the financing of the system, Sean, do you think that the fact that patients are paying more and more for their healthcare changes their expectations from just basic cure to client experience? Is it something you're experiencing in your practice?
I think it's important in the sense that, again, what has been mentioned, for a patient, whether you are a subsidized patient, for example, that you pay $50 compared to a private patient where you pay $5,000, patients still want experience. They still want good outcomes. They still want a good experience, no matter what class of patient he's in, whether I'm paying little or I'm paying more. So for us, it's important that patient experience comes first. They have to feel that they are being treated properly as a patient, and they've got to feel that their money, whether I pay $5 or I pay $5,000, I'm still paying money. So they've got to feel that they're getting their money's worth, So of course, if you go to a private institution, you have a nice decor, nice sofas, they have to feel that every cent is worth what they're paying. So for example, we do aesthetics as well, and in aesthetics there's no insurance, right? So when the moment the patient walks into the clinic, they have to feel that it's a nice environment. They're getting their whatever they're doing for their faces, whether it's lasers or Botox. They've got to feel that it's worth it. Whether I'm paying $1,000 or $10,000 like Altera for that service. Hence also in terms of what we call in terms of investment, I think it's important to look for things that helps to reduce cost. For example, recently we've been in contact with a company that does disposable endoscopes. Actually that helps to reduce cost. You're mentioning you do $30 endoscopies. That's incredibly low compared to Singapore. And if you can have things like disposable endoscopes that helps to reduce cost greatly, I think it's worth it. It's a disruptive technology. It's something that's worth considering.
I will have one more question for our panel, and then I will ask the audience if you've got questions for our panelists. But first, one question to you, Amit. You mentioned earlier that surgery was between art and science, and so is company valuation. So my next question is this. We're seeing in the region healthcare companies being valued at 30 times plus in terms of multiples, where the prices are much lower in Europe and in the US, certainly due to the fact that the markets are more mature. But do you see this kind of valuation as reasonable, justified, and most importantly, sustainable?
I have a couple of LPs in the room, so I need to be careful. 30 times can never be reasonable. Having said that, we're at an investment conference, and I don't think any of you want to leave here becoming healthcare experts only. So the fundamentals of investing, whether you invest in healthcare or in any other specialty, are the same. You buy cheap, monitor the companies, and exit right. Basically, buying cheap is what is important. Now, the problem that we are facing in Asia is that there's a scarcity of good quality assets. And because of that, there is a bunch of money chasing very limited number of assets. Healthcare, unfortunately, and I say that unfortunately deliberately, has become sexy. And everybody wants a portfolio, especially in an agnostic fund, to turn around and have that. Having said that, we all know you don't make money on trends, you don't make money on macro, you make money the hard way, of which is investing right. And to my mind, we are at the beginning of the slope where healthcare in this market is going to continue to grow. So the valuations in Asia, there's only one word, they are insane. And you're just not talking about public comps, I'm talking about strategic PE deals, I'm talking about people coming in and putting money to work in healthcare. In the past 15 years of healthcare investing, I have never seen healthcare multiples come down, regardless of what the market is doing, whatever's happening. So to my mind, the only way to fight this battle of high healthcare valuations is to grow the market, that you have more and more quality companies coming out so that we have more to choose from. And the more the companies list on local stock exchanges, I think that's going to play a direct role. Healthcare is not going away, it's fundamental infrastructure. It is a core right. And as was mentioned by you earlier on, I do not know of a single government in this market and in this region who is investing enough on healthcare. So healthcare will continue to grow over the next 10 to 15 years. Unfortunately, it's not that easy to make money as it's made out to be.
Do we have some questions from the audience for our panel?
Hi. My question is on preventive healthcare. So like Dr. Sean, in your opening address, you actually mentioned that your medical group actually is shifting your focus more and more on the preventive healthcare. So I was just wondering, like, as you know, your medical group, what are the changes in business model and any changes in the emphasis on the service and product that you guys are, you know, providing more emphasis in alignment with preventive healthcare? And also, like, I was questioning, like, how, you know, this change in the emphasis on the preventive healthcare, how the, you know, shareholders and potential investors react to this change and its, you know, potential change in the profit margin. That's my question.
Thank you for your question. Like I spoke about earlier, for us, our core business is still doctor-based. We still see patients, but we have a paramedical arm that does that try to look at deals or try to invest in spaces that are like what you said, preventive healthcare. And I think in Singapore at least, or in developed nations, one of the major preventive healthcare models would be screening, health screening. You know, you try and catch any potential problems or chronic diseases or cancers at an early stage. You refer to the correct specialist, you treat the patient, you solve the problem, the patient goes home happy. So that is one way of preventive healthcare. You know, we also look at technologies that are able to try and catch a disease earlier. I was mentioning a bit earlier on about AI involvement. You know, so we are in contact with a company that is able to try and capture or at least diagnose diseases. Some of the, you can't catch everything, you know, but at least the few main important ones, we try and diagnose that earlier, and we can refer the patient to the correct specialist at an earlier stage. So all these are actually preventive healthcare. We try to do more for less. We try to do more for the patient in the end, but at least at a cheaper price, because you solve the problem earlier. So in that sense, it's preventive healthcare. And we are actually focusing a bit more on that as well, because we think it's the way to go towards the future. And that's in part of our business plans.
If I may add on this in a couple of things. Just look at from the private sector point of view. Traditionally, preventive medicine, preventive health is the job of the government, because we only focused on, as rightly you said, screening, vaccination, patient education. But preventive medicine goes beyond that a little bit when you take it to the private sector. So what happens after that is the question. So we're looking into now more from the private sector point of view, who can pay if the government will stop such a thing, if the government stops. What else you can do to make sure that preventive medicine is a certain section. So there's a new division of preventive medicine is preventing the comorbid conditions. So once you catch the people on the risk, at risk of diabetes, hypertension, at risk of obesity, heart disease, then you can really still look into their well-being, wellness. That goes into now a little bit on the corporates as well as the private insurance companies, because they are responsible either managing their employees' health or the employee benefit, or insurance companies to make sure that whatever the premium they got to manage that risk of that population, they can look into that. So at the private sector point of view, preventive medicine is becoming very, very attractive once you get into that area. So because of that, for example, we set up a division just to be able to do this, and working quite traction from the large corporates and insurance companies to pay for that. So it's a very interesting new area to move into, actually.
Well, thank you very much, and thank you very much for being here today. We are not going to hold you hostage any more longer. We think that lunch is being served outside. But obviously, if there are any more questions, we will be outside at lunch as well with the panelists, so feel free to speak with any of us. And I would like you to join me in thanking our three panelists today.